About the size of your fist, the human heart is the most important muscle in the body. It can beat more than 100,000 times a day, pumping about 2,000 gallons of blood through a 60,000-mile network of vessels in the body. The human heart is made up of four major chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart receives blood that is low in oxygen from veins all over the body. It then pumps the blood through the pulmonary arteries into the lungs where it will become reoxygenated. The left side of the heart receives this oxygen-rich blood from the lungs. Then it pumps the blood through the aorta back out to the rest of the body through a complex network of arteries, arterioles, and capillaries. While blood is circulating through the body, it delivers oxygen and nutrients to tissue through the capillaries, and at the same time picks up carbon dioxide and other waste material. The veins return the deoxygenated blood to the right atrium, and the cycle begins again. The heart has four valves. Each valve is like a one-way door that keeps the blood in the heart flowing in the same direction. The valves are made up of 2 or 3 small but strong flaps of tissue called leaflets. Leaflets open to allow blood to flow through the valve and close to prevent blood from flowing backward. The opening and closing of the valves is controlled by blood pressure changes within each heart chamber. The tricuspid valve is positioned in the heart's right side between the right atrium and right ventricle. The pulmonic valve separates the right ventricle from the pulmonary artery. The mitral valve is positioned in the heart's left side between the left atrium and the left ventricle. And the aortic valve separates the left ventricle from the aorta. As blood circulates through the heart, some of the blood flows into a set of much smaller blood vessels that provide blood directly to the heart. These arteries, called coronary arteries, surround or crown the heart. This separate circulatory system, called coronary circulation, keeps the heart nourished and oxygenated. The two main branches of the aorta that nourish the heart are the right and left main coronary arteries. Coronary artery disease, which occurs when there is a buildup of cholesterol plaque, affects the arteries of this circulatory system and causes a decrease in blood flow to the heart muscle, resulting in possible damage to the heart or a heart attack. The beating of the heart, which is its rhythm, is regulated by electrical impulses generated by your heart muscle. These impulses begin in the sinoatrial node and cause your heart to contract. Sometimes the sinoatrial node is also referred to as your heart's natural pacemaker, since it keeps the heart rate constant and consistent. The impulses then travel to the atrioventricular node, where the signal is checked and then sent through the ventricles, which causes them to contract. Your heart rate can change based upon external conditions such as diet, exercise, stress, or even hormonal factors.
Heart disease affects more than 20 million Americans and is one of the leading causes of death in this country. But what exactly does the term heart disease mean?
When most people talk about heart disease, they usually mean coronary artery disease, the illness which causes both angina and heart attacks. However, there are also other conditions that affect our cardiovascular system, such as congestive heart failure and aneurysms. Coronary artery disease occurs when there is a buildup of fatty plaque known as atherosclerosis inside the coronary arteries. When the buildup is sufficient to restrict but not stop blood flow into the heart, the result is angina, a discomfort or pain in the chest. Angina isn't actually a disease, but rather it is a symptom of coronary artery disease. When the buildup of atherosclerosis is sufficient to interrupt blood flow to the heart, the result is the death of heart muscle cells, commonly known as a heart attack. So, both angina and heart attacks are really caused by the buildup here in the coronary arteries. Congestive heart failure, on the other hand, occurs when the heart is pumping inefficiently and can no longer meet the body's need for blood. The ventricles, which are the main pumps within the heart, often are to blame for the insufficient blood flow. The congestive part of congestive heart failure comes from the backup of blood in the veins leading into the heart. This backup causes the kidney to retain fluids, Other less common diseases affect other parts of the heart. For example, when a patient is suffering from an aneurysm, that means that their aorta has swollen, creating a bulge in the artery.
Failure occurs when the heart's pumping becomes impaired, resulting in inability to meet the body's oxygen demands. The most common type of heart failure, left-sided failure, occurs when the left ventricle cannot contract sufficiently. Afterload is the amount of resistance the ventricle pumps against. In order to pump effectively, the ventricle must generate sufficient pressure to overcome this resistance. Left heart failure occurs when arteries downstream constrict, resulting in increased afterload, resistance too high for the ventricle to pump against. A heart attack can also cause left heart failure. In a failing heart, blood accumulates in the left ventricle, causing pressure. This pressure, called preload, causes the ventricle to expand. Increased preload worsens the ventricle's ability to pump. Accumulating blood stretches the cardiac muscle fibers, pulling myosin and actin filaments farther apart. When overstretched, myosin molecules cannot connect with actin. The myosin-actin cross bridges cannot swivel. The inability of the cross bridges to swivel makes contraction weaker, reducing the likelihood that sufficient blood will be pumped. The progression of heart failure continues as blood accumulates. Built-up blood in the left ventricle causes a backup of blood throughout the pulmonary circuit, leading to pulmonary congestion. This associated congestion is responsible for left heart failure, also known as congestive heart failure. Blood buildup in the lungs causes difficulty breathing, especially when a person is reclining. Pulmonary congestion also reduces the ability to oxygenate the blood, worsening systemic hypoxia. The progressive nature of congestive heart failure, if untreated, ultimately causes death.